Have you ever wondered, what is mental health care? Well, you're not alone. It's a question that many people grapple with, particularly as the conversation around mental health becomes more prominent in our society. Mental health care is the umbrella term for all the ways we look after our psychological well-being. It encompasses everything from self-care practices like meditation and mindfulness to professional therapies and treatments. It's not just for those who have been diagnosed with a mental health condition, but for everyone. Just as we take care of our physical health by eating well and exercising, our mental health requires attention and care too. Why is mental health care important, you ask? Because our mental health affects how we think, feel, and act. It influences our ability to handle stress, relate to others, and make choices. It's integral to our overall health and well-being. When our mental health is in a good state, we're more likely to lead a fulfilled, productive life. But when it's not, it can lead to serious issues like depression, anxiety, and even suicide. In the world of mental health care, there are many players. There are therapists, psychiatrists, psychologists, counselors, and social workers, all of whom play a crucial role in providing care. They offer a range of services, from psychotherapy and cognitive behavioral therapy to medication management and crisis intervention. But mental health care isn't just about professionals and their services. It's also about empowering individuals to take charge of their mental health by providing them with the tools and resources they need to do so. This could be through self-help books, online resources, or community programs. In short, mental health care is about supporting people in maintaining their mental health, helping those who are struggling, and providing treatment for those who need it. It's a vast, complex field, but one that is essential for our individual and collective well-being. Now that we know what mental health care is, let's delve deeper into its different types. Before we continue, remember to hit that subscribe button. By subscribing, you'll join our community of like-minded individuals. Together, we can achieve success and wealth as we learn, grow, and support each other. Click subscribe now, and let's dive back into today's topic. Mental health care isn't a one-size-fits-all solution. It comes in various types. The diversity in mental health care reflects the unique needs of each individual. Let's take a closer look at these types. First, we have inpatient care. This type of care is typically used when a person is going through an acute crisis and needs round-the-clock medical attention. Inpatient care usually takes place in a hospital or a specialized psychiatric facility. It provides a safe environment where the person can receive immediate intervention and stabilization. Next, we have outpatient care. This is the most common type of mental health care. It allows individuals to live their daily life while also receiving treatment. Outpatient care can include individual or group therapy sessions, medication management, and regular check-ins with a mental health professional. Third on our list is residential treatment. This type of care is typically used when a person needs intensive, structured support, but not necessarily the medical attention provided in inpatient care. Residential treatment centers offer a therapeutic environment where individuals can focus on recovery with the assistance of a multidisciplinary team of professionals. Last, but definitely not least, we have community services. These services play a crucial role in supporting individuals with long-term mental health conditions. They offer a wide range of resources, from housing assistance to vocational training. and provide the necessary support for individuals to live independently and productively in their communities. Each type of mental health care has its unique purpose and plays a vital role in addressing the diverse needs of individuals with mental health conditions. It's important to note that a person might need different types of care at different times based on their current situation and recovery progress. Understanding these types can help us comprehend the diverse nature of mental health care. So the next time you or someone you know is seeking help, remember that there are a variety of options available. Mental health care is not a one-size-fits-all, but a tailor-made solution designed to meet the unique needs of each individual. Behind every successful mental health care plan are dedicated professionals like therapists and psychiatrists. These experts are the guiding forces, steering the course of mental health care, ensuring that it aligns with each patient's unique needs and circumstances. Let's start by understanding the role of a therapist. Therapists are skilled in the art of conversation, facilitating meaningful discussions that can help individuals explore their feelings, thoughts, and behaviors. They employ a range of therapeutic approaches, such as cognitive behavioral therapy and psychotherapy, to help patients cope with various mental health conditions. Their role is to guide, support, and empower patients on their journey to mental wellness. On the other hand, psychiatrists are medical doctors who specialize in mental health. They have the ability to diagnose and treat mental health disorders, utilizing a blend of psychotherapy, psychosocial interventions, and medication. Psychiatrists play a crucial role in managing complex mental health conditions that may require medical treatment. Together, therapists and psychiatrists form a formidable team, working in harmony to provide comprehensive mental health care. They assess the patient's condition, devise a tailored treatment plan, and continually monitor progress, making necessary adjustments along the way. Their goal is to not only treat the symptoms, but also address the underlying issues, helping patients to live healthier, more fulfilling lives. Their expertise and commitment form the backbone of effective mental health care. Therapies form a significant part of mental health care. But what are these therapies? Let's dive into the world of mental health therapies, specifically cognitive behavioral therapy, often abbreviated as CBT, and psychotherapy. Both of these therapies have proven to be highly effective in managing and treating various mental health conditions. Let's start with cognitive behavioral therapy. CBT is a form of therapy that focuses on how our thoughts, beliefs, and attitudes affect our feelings and behavior. It's an active, direct approach that helps individuals challenge and change their unhelpful cognitive distortions and behaviors, improve emotional regulation, and develop personal coping strategies. CBT is widely used to treat anxiety and depressive disorders, but its utility doesn't stop there. It's also beneficial for people dealing with stress, PTSD, and even substance abuse disorders. Next, we'll discuss psychotherapy, a broad term that encompasses several types of therapy, including but not limited to psychodynamic therapy, interpersonal therapy, and humanistic therapy. At its core, psychotherapy is about communication. It's a process where trained professionals help individuals understand and solve problems, modify behavior, and manage feelings by discussing thoughts, feelings, and behaviors. It can help individuals with various mental illnesses such as depression, anxiety disorders, bipolar disorder, and schizophrenia. Psychotherapy can also be beneficial for individuals dealing with life's stresses, such as family and relationship problems, job stress, or the death of a loved one. It's a versatile tool that can be adapted to meet the specific needs and concerns of each person. In conclusion, these therapies, cognitive behavioral therapy and psychotherapy, are critical tools in mental health care. They offer individuals the chance to understand their mind better, change harmful patterns of thought or behavior, and learn new ways to react to stress and challenges. These therapies, when used appropriately, can significantly improve a person's mental health. Knowing about mental health care isn't enough. We should also know how to access it. So, where do we start? First, it's essential to find a mental health care provider. This can be a psychiatrist, psychologist, or counselor. It's like finding the right pair of shoes. They need to fit well and make you feel comfortable. You can find a provider by getting a referral from your primary care doctor or by searching online directories and reviews. Next comes scheduling an appointment. This might seem straightforward, but it's important to consider the provider's availability and how it aligns with your schedule. Remember, consistency is key in mental health care, so choose a time that works best for you. Now, understanding insurance coverage can be a bit complex, but it's a crucial step. Check with your insurance provider to understand what mental health services are covered. If you don't have insurance, don't worry, there are still options. Various community health centers offer services on a sliding scale basis, and some providers offer pro bono services. Finally, it's worth mentioning that accessing mental health care may feel daunting. But remember, taking the first step is often the hardest part. Once you've made the decision to seek help, you're on the path to better mental health. Access to mental health care shouldn't be a challenge. It's a right. Hearing from those who have walked the path can provide a unique perspective. Let's delve into a few anonymized experiences. One individual, let's call them Alex, was initially apprehensive about seeking help for their anxiety. However, once they embarked on their journey with cognitive behavioral therapy, they found a new sense of control and ownership over their emotions. Then there's Taylor, who was battling depression. Taylor's turning point came when they started psychotherapy. This process helped them understand the roots of their feelings, and most importantly, taught them strategies to manage these emotions. And we can't forget about Jordan. Struggling with bipolar disorder, Jordan found support and guidance in a psychiatrist who helped them navigate through the complexities of medication management. These stories, while unique, share a common thread. Mental health care has made a profound impact on their lives. Mental health care can indeed make a profound difference in people's lives. So we've taken a journey through the realm of mental health care today. We've explored the various types of care available, the crucial roles therapists and psychiatrists play, and the different therapies such as cognitive behavioral therapy and psychotherapy. We've also shed light on how to access these services. The patient experiences we shared underline the profound impact of mental health care. Remember, mental health care is essential, and everyone deserves access to it. Thanks for watching. Embrace the shadows, hit subscribe, and stay tuned for our next video. Until then, harness the darkness and forge your path to greatness.